If you've ever been fully turned on, genuinely into what's happening, and found that your erection faded faster than you wanted it to, or never quite got as firm as it used to, you've probably felt confused, maybe even a little ashamed, because it doesn't match the story we're told about how arousal is supposed to work, the idea that desire and physical response are basically the same thing wired directly together. So if you want it enough, your body should just cooperate. But that's not actually how erections work, and understanding the real mechanism changes everything about how you think about this, because desire and erection are controlled by two related but distinct systems in your body. And when one of them isn't functioning properly, all the desire in the world won't fully compensate for it. Let's start with what an erection actually is, mechanically, because most people have never had this explained clearly. An erection happens when signals from your brain, triggered by arousal, whether that's visual, physical, emotional, or a combination, travel down through your spinal cord and out through nerves into the penis, where they trigger the release of a chemical called nitric oxide. That nitric oxide causes the smooth muscle tissue inside cylindrical chambers called the corpora cavernosa to relax. As that muscle relaxes, blood flows in through the arteries much faster than it can drain out through the veins, and the tissue fills up and becomes rigid, essentially trapping blood inside under pressure, which is what makes an erection firm rather than just engorged. Maintaining that erection requires this entire system, nerve signaling, chemical release, blood inflow, and blood retention, to keep working together continuously. If any single part of that chain is compromised, even slightly, you can end up with an erection that starts fine but doesn't last, because desire got the process started, but something downstream couldn't sustain it. This is the core reason why you can want something intensely and still have your body not fully deliver. Wanting is a signal, but the erection itself depends on a physical cascade that has to execute correctly from start to finish. And there are a lot of places in that cascade where things can go wrong. One of the most common and most overlooked causes is simply blood flow, specifically vascular health. Your penile arteries are actually quite small compared to other arteries in your body, which means they tend to show the effects of restricted blood flow earlier than larger vessels do. This is actually significant beyond just sexual function, because erectile difficulties are sometimes one of the earliest detectable signs of broader cardiovascular problems, showing up before someone might notice symptoms like chest pain or shortness of breath, since the smaller vessels get affected first. Things like high blood pressure, high cholesterol, diabetes, obesity, and smoking all damage the lining of your blood vessels over time, a process called endothelial dysfunction, which impairs the vessel's ability to relax and expand properly, meaning even strong arousal signals from your brain can't produce the full blood flow response needed to create and maintain firmness. If you're noticing this pattern, especially if it's a newer development and not something you've dealt with your whole life, it's genuinely worth getting your blood pressure, blood sugar, and cholesterol checked, not because it's necessarily something serious, but because catching cardiovascular issues early through a symptom like this can be genuinely protective for your long-term health, not just your sex life. Testosterone plays a role here too, though it's smaller and more nuanced than a lot of people assume. Testosterone is important for maintaining desire and supporting the nitric oxide pathway we talked about earlier, but you don't need sky-high testosterone to get or maintain an erection. Plenty of men with completely normal, average testosterone levels have zero difficulty, and plenty of men with technically low testosterone still get erections just fine because arousal pathways can partially compensate. Where testosterone becomes more clearly relevant is when levels significantly below normal range, which can happen due to aging, certain medical conditions, obesity, chronic stress, or poor sleep. And in those cases, you might notice not just erection issues, but also lower overall desire, fatigue, and mood changes alongside it. This is worth getting checked with an actual blood test if you're experiencing a cluster of these symptoms together, rather than assuming low testosterone based on erection issues alone, since isolated erection problems with normal desire and energy usually point elsewhere. Now let's talk about the nervous system side of this, because it's just as important as blood flow and gets discussed far less. The nerves responsible for triggering an erection can be affected by a surprising number of things. Diabetes is one of the most significant causes of nerve damage, called diabetic neuropathy, which can specifically impair the nerve signals needed to initiate and sustain an erection. And this is actually one of the most common causes of erectile difficulty in men with diabetes, sometimes appearing even when blood sugar is reasonably controlled. Certain surgeries, particularly prostate surgery, can also damage or affect these nerves, which is why doctors performing prostate procedures now often use nerve-sparing techniques, specifically to try to preserve erectile function afterward. Spinal cord injuries, multiple sclerosis, and other neurological conditions can interrupt the signal pathway as well, at any point between the brain and the penis. If you have any of these underlying conditions, erectile changes are a known and expected possibility, not a personal failure or a sign that something is wrong with your desire. Now here's where things get particularly relevant for a lot of people, especially younger men, because when you search for information about this topic, most of what comes up focuses on older men with cardiovascular or nerve issues, but a huge number of people dealing with this are dealing with something almost entirely psychological, specifically performance anxiety, and the mechanism behind this is worth understanding in detail because it's genuinely different from the physical causes we just covered. Your body's ability to get and maintain an erection depends heavily on your nervous system being in what's called a parasympathetic state, essentially a calm, relaxed, rest and digest state. Arousal and erection are parasympathetic functions. Anxiety, stress, and fear activate the opposite system, your sympathetic nervous system, the fight or flight response. These two systems work against each other, and sympathetic activation actively suppresses the physical processes needed for an erection, redirecting blood flow away from non-essential functions, which your body, in a survival sense, categorizes an erection as being. So if you're anxious about your performance, worried about whether you'll finish too quickly, whether you'll stay hard, whether your partner will be satisfied, or even anxious about something completely unrelated like work or money that's sitting in the back of your mind, that anxiety can directly and physically suppress your erection regardless of how much you consciously want and desire the person you're with. This creates one of the cruelest feedback loops in human sexuality. You lose an erection once, maybe due to stress, alcohol, or just an off day, which everyone experiences at some point and which is completely normal, but instead of shrugging it off, you start worrying it'll happen again. And that worry itself becomes the sympathetic trigger that causes it to happen again, and now you're anxious every single time, which keeps the cycle going, sometimes for months or years, entirely disconnected from any underlying physical cause. This is called performance anxiety-induced erectile dysfunction, and it's remarkably common, particularly in younger men who otherwise have no cardiovascular or hormonal issues at all. The tricky part is that from the inside, it doesn't feel like anxiety. It feels like your body betraying you your genuine desire, which is exactly the confusion in the title of this conversation, wanting something and your body not delivering, and that mismatch is often the anxiety it's operating largely outside your conscious awareness. Pornography use is worth addressing honestly here too, because there's a real evidence-supported mechanism at play, separate from any moral judgment about porn itself. Frequent pornography use, especially with rapid novelty seeking and switching between videos, can recalibrate what level and type of stimulation your brain expects in order to trigger arousal signals. Real partnered sex involves a different, often lower intensity and slower building pattern of stimulation, both physical and visual, and for some people a pattern of needing high intensity, rapidly escalating visual stimulation to get aroused. Real sexual encounters with a partner may not trigger the same signal strength, leading to weaker or shorter lasting erections despite genuine desire and attraction to the partner in front of them. This isn't true for everyone who watches porn. Plenty of people have no issues at all, but if you've noticed this pattern specifically, difficulty with a partner but no difficulty alone, it's worth being honest with yourself about, since it often responds well to simply reducing frequency and intensity of solo pornography use over a period of weeks. Alcohol deserves a direct mention because it's probably the single most common everyday cause of erection difficulty, and it's poorly understood by most people. A small amount of alcohol can actually reduce anxiety and increase confidence, which sometimes helps in the short term. But alcohol is a central nervous system depressant, and beyond a certain point, it suppresses the nerve signaling needed for arousal, impairs blood flow, and dulls physical sensation overall, all of which work directly against the mechanisms we described earlier. This is sometimes called whiskey dick informally, and it is extremely common, entirely temporary, and not a sign of any underlying problem. It's simply pharmacology. Alcohol is doing exactly what a depressant does to your nervous system. Certain medications can cause this too, and it's worth reviewing your prescriptions if you're experiencing new erection difficulties after starting something new. Antidepressants, particularly SSRIs, are one of the most common culprits since they affect neurotransmitter systems involved in both desire and physical arousal response. Blood pressure medications, particularly older classes like beta blockers, can also interfere with the blood flow mechanisms needed for firmness. Antihistamines, certain anti-anxiety medications, and some prostate medications can have effects too. If you've started a new medication around the same time these issues began, that timing is a meaningful clue, and it's worth discussing with your prescribing doctor, since there are often alternative medications with fewer sexual side effects, though you should never stop a prescribed medication on your own without medical guidance, since the underlying condition the medication treats matters more than the side effect in most cases. Sleep and chronic fatigue matter more than most people realize as well. Poor sleep disrupts testosterone production, since a significant portion of your daily testosterone is produced during deep sleep cycles, and it also increases baseline stress hormone levels, both of which work against healthy erectile function. If you're chronically sleep deprived, addressing that alone sometimes resolves erection concerns that had nothing to do with any of the more commonly discussed causes. Relationship dynamics and emotional connection matter too, and this isn't just a soft, feel-good point, it has real physiological backing. Feeling emotionally unsafe, disconnected, or anxious within a relationship, even if you're still physically attracted to your partner and genuinely desire them, can activate the sympathetic stress response we talked about earlier, suppressing physical arousal regardless of how much you want the encounter to go well. This is why erection difficulties sometimes appear specifically with one partner and not others, or specifically during periods of relationship tension, which can be confusing and painful for both people involved if they don't understand the mechanism behind it. So what actually helps across all of these different causes? The starting point, honestly, in addressing the physical health basics, since they're foundational to having blood pressure and cholesterol checked, especially if it's a new pattern rather than a lifelong one, which damages blood vessels directly, is one of the single most modifiable risk factors here. Moderating alcohol intake, particularly avoiding heavy drinkings before sex, improving sleep consistency, and building regular cardiovascular exercise to your routine, since exercise directly improves vascular health and nitric oxide is involved in erectile function. Consistently showing men who exercise regularly report significantly better function than said in men of the same age. On the psychological side, if performance anxiety seems like the driving factor, the approach paradoxically involves taking pressure off performance and for a period of time. Some sex therapists recommend deliberately removing intercourse as a goal for a few sessions with a partner, focusing instead on closeness and pleasure without the pressure of achieving or maintaining an erection, which breaks the anxiety feedback loop because there's nothing to fail at anymore, often return naturally once that specific pressure is removed. Open, honest communication with a partner about what's happening also matters enormously, since silence and secrecy tend to amplify shame and anxiety, while a partner who understands what's going on can actually become part of the solution rather than an unwitting source of additional performance pressure. If you've addressed the lifestyle factors, ruled out or address you persists, this is absolutely something worrying to a doctor rather than just quietly living with or trying to work around indefinitely. Can sometimes be an early warning sign of cardiovascular issues, regardless of feel about the sexual aspect of it. And because effective treatments except every category of cause we've discussed, from medications that support blood flow when testosterone is genuinely low, to referrals for physical therapy, to psychological counseling or sex therapy for anxiety-driven cases. The most important thing to take away from all of this is that an erection not lasting, even when desire is completely genuine, is not a referendum on your masculinity, your attraction to your partner, or your worth. It's your telling you that somewhere in a fairly complex chain of nerves, hormones, and mental state, something is being disrupted. And that disruption almost always has an identifiable cause and a workable path forward once you understand what's actually happening, instead of just feeling confused and ashamed by the mismatch between what you want and what your body is doing.